The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
Telehealth is transforming the healthcare experience with solutions designed to help people live their healthiest lives. Primary 360 is an integrated virtual primary care solution that delivers and empowers whole-person health. From wellness and prevention to acute care and specialty needs, Primary 360 inspires lasting relationships between people and providers through a unified, whole-person experience.
Hear in their own words why they should win.
Many healthcare consumers today are disconnecting from traditional primary care, since the current experience is largely not meeting consumers' expectations. In fact, approximately 50% of adults from the ages of 18 to 49 have not had a recent primary care visit, and that means tens of millions of adults are missing their necessary screenings, yielding poor health outcomes across our population. The entire primary care experience needs to be reimagined, and that is exactly what Primary 360, or as we like to call it, P360, does. We do this by understanding a needs over time, proactively navigating members to the right care, whatever the need. P360 provides a continuous relationship with both a dedicated primary care physician and a dedicated care team where members benefit from one experience that is convenient and highly personalized. P360 is optimized to act as a hub for Teladoc Health's broader suite of specialty care, chronic care, mental health, and complex care offerings, in addition to offering the last mile services to the member's home like connected devices and in-home labs. And the member experience speaks for itself. In P360, new patient visits happen in less than 7 days compared to a month or more in traditional settings. More than 50% of members are using an additional Teladoc Health service like mental health care or chronic care management. About 25% of those living with diabetes and hypertension are newly diagnosed in their P360 visits. And lastly, the average new patient visit is over 50 minutes. That compares to a traditional average of around 15 minutes and enables the kind of dialogue and relationships that members love. And in hearing from our members directly, in March of this year, one member said they've never felt a connection with a primary care physician like this before. Another called P360 the best experience they've ever had related to healthcare. And it's the quotes like that, paired with those proof points we are seeing, that have all of our stakeholders, that's the health plans, the employers, the members, and the providers, all excited about P360 and why the product is already winning awards. And the magnitude of the problem we are trying to solve is unmatched, as is our ability to address it. That's why P360 should win the Telehealth Innovation Award.
As the pandemic unfolded, hospitals and clinics got overloaded with patients. Ratios nurse to patients were increased heavily, making the job of nurses extremely tiring and stressful at the same time. Real and false alarms were creating additional fatigue for medical staff. When hospitals tried to increase the number of clinical staff, they faced not only difficulties due to a shortage of clinical people, but they had to increase wages by up to 50% in order to be able to maintain the current ones. With COVID-19 going away, the issue of nursing shortages is staying around, and their tech and platform is solving this problem while reducing the cost to health systems. Under HelloCare brand, our team has created the world's most integrated and powerful virtual care delivery platform, which consists of software or hardware, which sits on top of the TV, and artificial intelligence to track patients' vital signs and behavior so that we can prevent falls, detect inactivity, and other undesired behaviors, and of course improve patients' experience overall by being close to them 24/7. Our platform uses advanced alerting and communication workflow to inform medical staff when help is needed, while allowing patients to bring virtually their loved ones for a family visit. We don't stop here. Our platform provides a solution for the continuum of care, where patients can be discharged earlier, and then we can monitor while they are at home, close to their loved ones, where healing is much faster. Any medical staff, including nurses, physicians, and specialists, can check the patient 24/7, including their vital signs measurements, completely remotely.
Most people think of genetic testing as a mail-order kit that helps you discover your genetic ancestry or common conditions. But in order to unlock the vital information within your genome, you need more than a single test. Inside your genome, that complex code that runs the systems in your body, exists more than 20,000 genes that are indicators for genetic conditions. And the medical industry has developed over 75,000 tests to identify different ways genetics can affect your body. That's good news when you consider that 10 to 20% of the world's population carries at least one of 6,000 known genetic diseases. The bad news? Finding your way to the right tests on your own is extremely complex. At Genome Medical, we simplify things for you by helping you and your doctor navigate this complex genetic testing landscape. We connect you with genetic specialists who can evaluate your medical history, health risks, and select the correct tests for you. Once your genome is tested, we don't just send you your results. We help you interpret them, answer your questions, and guide you toward a healthier future so you can take action.
Hear in their own words why they should win.
Genome Medical is changing the face of healthcare by ensuring rapid, equitable access to genomics-based care. We're shepherding in a new era of precision medicine by addressing the care gaps present today. We have pioneered a virtual care delivery model which connects our team of genetic specialists with patients everywhere. In a healthcare system where there continues to be a shortage of genetics expertise, Genome Medical eliminates traditional geographic and workforce barriers that have limited equitable access to essential genetic health services. This model represents the future of clinical care delivery for prevention, diagnosis, and personalized care. We are applying AI and technological advancements to better identify patients at increased risk of hereditary disease. One of our tools is called RISE, and this collects and analyzes family and personal health history to determine if a patient meets genetic testing criteria. The patient completion rate is 95%, and approximately 23% of patients screened meet guidelines and may benefit from genetic services and a change in care. This is our superpower. We apply technology and genomics expertise to give people the power to personalize their health. We make it easier to bring forward the standard of care in genetics. This improves outcomes and lowers the cost of care by appropriately provisioning service. We should win because genetics impacts all of us.
Hi, Tony. It's great to see you again. How are you today?
This telehealth kind of thing is brand new, and I like it, especially since it's so easy.
That is so conducive to us building a really good rapport and a close working relationship for life.
She's a brilliant doctor, and I'm so lucky and privileged to be able to work with her personally because it's really contributed to my success.
Take good care, and I'll see you next time.
Hear in their own words why they should win.
Hi, I'm Ryan McQuaid, CEO of PlushCare. 10 years ago, I was so sick that I couldn't even walk to my own kitchen. Like 25% of Americans, I didn't have a primary care doctor that I could turn to. I was lucky though. I had a physician friend, Dr. James Wantuck, who could help direct me to the right care. Unfortunately, many people don't have a physician friend who they can easily call. So James and I teamed up to change that. In 2015, we founded PlushCare, a virtual primary care and mental health company focused on democratizing high-quality care and delivering a wow patient experience. We help every patient choose a primary care doctor from one of the top medical institutions in the US, a world-class therapist, and a dedicated care team. Together, they deliver a patient's ongoing care. There's no waiting room, no hidden costs. It's proactive, it's personalized, and it's people-first care. In 2021, we combined forces with Accolade and 2nd.MD to bring together health and benefits navigation, virtual primary care, online therapy, and expert medical opinions, all into one solution for patients. And because of that, we're able to deliver a personalized healthcare experience. Here's an inside look into one patient's story.
This telehealth kind of thing is brand new, and I like it. I don't have to get in the car and drive and wait in a waiting room. It's easy to manage the whole thing on your own phone, and I have access to this whole group of experts. I live in Honolulu, which is 3,000 miles away from most medical experts, and so through PlushCare, I can get personalized, high-quality health care wherever I am, whenever I need it.
People experiencing homelessness don't always get the help they need. Now the city is bringing it to them.
CBS 2's Jenna DeAngelis got a close look at the initiative.
We got all our supplies.
With backpacks full of medical gear, this team of healthcare workers hits the streets of Harlem to help vulnerable New Yorkers.
My name is Pollock. I'm a physician assistant with New York City Health and Hospitals.
Alongside PA Pollock Patel is a certified nursing assistant and a social worker checking on a man outside 125th Street Station.
Do you feel well today?
The team offers vital services to people in need with a focus on those experiencing homelessness.
Screening for hypertension, diabetes, wound care, vaccines.
Street canvas teams are the newest addition to New York City Health and Hospitals Test and Trace SHOW initiative, which stands for Street Health Outreach and Wellness, in partnership with mobile health provider DocGo.
It's very difficult for this population to get any type of primary care. We want to bridge the gap from them having no care at all to getting them into a primary care safety net clinic.
The program deploys 6 mobile health units around the city, offering an array of services from mental health and substance use care to free COVID tests and vaccines.
The roving team has really been crucial in going out and educating our target population, especially about, getting vaccinated.
Once others saw the team giving this man his flu shot, they jumped in line for theirs.
Being that I got the opportunity to do it today, I might as well take care of it.
Some people can't get out to actually go and get checked out, so I think it's a beautiful thing that you bring it to them.
And it doesn't stop here. The team helps connect patients like this one to doctors for continued care.
I'll get you all the information as to where you need to be.
Since April, the SHOW team has reached more than 60,000 New Yorkers with the goal to care for many more with their ongoing efforts. In Harlem, Jenna DeAngelis, CBS 2 News.
And many of those treated are then connected to the primary care safety net clinic at Bellevue.
Calibrate guarantees sustainable weight loss by combining doctor-prescribed medication, one-on-one video coaching, and lifestyle changes to reset your metabolic system. Take control of your weight and your health at joincalibrate.com.
Hear in their own words why they should win.
Hi, my name is Isabel Kenyon, and I'm the founder and CEO of Calibrate, a metabolic health company on a mission to change the way the world treats weight. To change the way the world treats weight, we are establishing the standard of care for obesity treatment, expanding access to ensure that safe, effective, and stigma-free treatment is available for people with overweight and obesity. We're also addressing how we think about weight by amplifying what research has proven, that weight isn't about willpower, it's about biology. Obesity is a chronic disease, and we should treat it that way. In 2020, we introduced the first outcomes-based digital model for obesity treatment. We address underlying physiology, combining doctor-prescribed medications with an intensive lifestyle intervention, delivered through one-on-one video coaching and a comprehensive curriculum to change the way you eat, sleep, exercise, and manage your emotional health. Our program is tailored to our members' biology for guaranteed weight loss of at least 10%, sustained results, and improved metabolic health markers. Since we launched, we've delivered real published results in an industry where 95% of diets fail. Now we are expanding access to reach the 200 million Americans with overweight and obesity.
Hear in their own words why they should win.
As a small business, your team is like extended family. Offering access to healthcare is more than just a way to help them stay well. It's a way to show you care. Whether you're looking for an alternative to traditional health insurance or a way to upgrade the benefits you have, you deserve an option B. Introducing Galileo, the modern, affordable solution. At a low price each month, it's built for small and mighty teams like yours. Galileo lets your employees consult highly trained doctors through text or video and get quality care for almost anything, from primary to specialty, colds to high cholesterol. From their homes, the road, or wherever they are, Galileo is there for them 24/7 without an appointment. And with just for them reminders and proactive follow-ups, it's the easiest way for them to take care of their health. They can upload medical records, take health quizzes, get prescriptions written and lab tests ordered, plus get referred to specialists nearby, all in one place. And since Galileo isn't insurance, there are no copays or deductibles, so your employees pay less. Are you ready for the modern, affordable solution that cares for your people and your bottom line as much as you do? Get started with Galileo at smallbusiness.galileohealth.com.
Telecritical Care Hub Task Management is a simple and intuitive tool that is driving the care of our most critically ill patients. The application consists of 3 screens to manage calls and tasks. Together, these screens provide end-to-end process between the medical centers and off-site hubs. On the new task screen, calls from the ICU are received and the patient information is entered. Upon submission, the new task appears on the dashboard. Tasks have timers, audio alerts, and expiring notifications associated with them. The dashboard is divided into 3 areas: green for new tasks, white for tasks that are being worked on, and gray for tasks that have been completed. On the Modify Task screen, a user can select to reassign a task, enter comments for patient care, or close a task that has been completed.
Hear in their own words why they should win.
The Telecritical Care project gave my team the opportunity to directly touch and improve the lives of our members. Telecritical Care, or TCC, is a partnership between intensivists, these are elite critical care doctors and nurses who work in remote hubs, and hospitalists, these are doctors and nurses who deliver bedside care in our facilities. TCC leverages multiple healthcare systems as well as bi-directional audio-visual communication systems to link those intensivists to the hospitalists to provide care to our most critically ill patients. Bedside caregivers can get immediate consultations from the remote critical care experts, and proactive monitoring systems alert clinicians to deteriorating patients. The collaboration services team under Amy Reimer developed an application to merge data from the various healthcare systems into a consolidated interface so intensivists have access to all relevant patient information. Data entry was also consolidated. Previously, the same information needed to be entered into 3 to 5 different systems. The TCC Hub Task Management app streamlines this into one, increasing the efficiency of the clinical workflow and reducing human error. Further, the seamless passing of information, requests, and orders between the Telecritical Care Hub and the bedside resources increases the speed and quality of care. Now, the results of the pilot have been nothing short of astounding. The overall length of hospital stays reduced on average 28.5 hours. Total ICU stays reduced 13.9 hours. The mortality rate for ICU patients reduced 17%. Sepsis rates have declined, as have readmittance rates. And when you extrapolate that across KP's Northern California market, that's an estimated 120 to 600 lives saved every year. This is the reason we do what we do. We have a passion for improving the health and lives of our members and for forwarding KP's mission of providing excellent and affordable health care.
MedBridge Telehealth Virtual Visits is an easy-to-use, HIPAA-compliant platform that empowers healthcare professionals to provide high-quality care remotely, using real-time exercise streaming to support an experience that mirrors in-person sessions. MedBridge Telehealth allows you to expand access and increase efficiency through virtual triage and assessment, improve adherence by connecting with patients when and where it works for them, and drive better outcomes with post-discharge engagement. Getting started is simple. Connect with your patients, live stream exercise demonstrations, and share educational resources. You can also track pain, difficulty, and overall adherence. And because virtual visits sits within our patient engagement platform, any updates you make during your visit will be reflected in their patient portal and home exercise program. Additionally, patients can easily access virtual visits from their patient portal on desktop or their mobile device.
Hear in their own words why they should win.
So when I first embarked on the mission of MedBridge to democratize education with the ultimate goal of improving patient care as well as increasing accessibility, I wasn't quite sure how I was going to accomplish the goal and have the biggest impact possible, but I did know that I needed to bring on some amazing individuals that shared the passion and the vision that I did to help improve the chances that MedBridge would have the impact that it has today.
I remember going to our first ever conference. Andrew and I were there. Everyone was coming by our booth and we were saying, hey, we have an online education solution. And everyone had a really great response to that. And at the end of it, I remembered Andrew and I were in the parking lot and I called Justin and I remember saying, they actually like us. People actually love this idea.
When I joined, there was only like 50 people in the office and we're all kind of crammed in a room about this size, right? And now we're in this, we moved to that giant building and I don't even know how many employees we have anymore. I feel like it's getting close to 200. And the fact that I don't know the exact number is also telling of how big that number has gotten.
I think we're in all time zones across the US, which is pretty cool.
So if you go back to the early days and then you fast forward to today, it's still people united by this mission, just trying to solve these problems. And that approach and that passion and willingness to figure it out really resonates.
It was really something that was revolutionary for the industry at the time. I mean, we had a lot of people that were saying you'd never be able to develop online education that could actually make an impact or that clinicians would be interested in. You need to do hands-on education. And today, MedBridge is really the de facto, the standard in the industry.
There's so much room for growth when it comes to education and democratization of education within the healthcare industry.
What I'm really excited about is for someone to eventually say, I MedBridged it. Instead of like I Googled it, it's I MedBridged it.
One of the things that I love about MedBridge is it's not, okay, we got here, now we're done. But rather, now we got here, now let's do 10x more.
Hear in their own words why they should win.
Mend is an enterprise-grade patient engagement platform, and there's lots of different ways that we connect and engage with patients and help large healthcare organizations. We're making our submission today for our telehealth product, which has currently helped increase access to care for over 5 million patients and growing. All different scenarios, all different walks of life, every age, almost every state in the country. We're helping to increase access to care, whether it be in rural areas, for homeless populations, people just trying to manage their busy work and family schedules, different shelters, foster homes, really any type of scenario you can think of. Mend is providing solutions to hundreds of different customers and reducing no-shows and just helping to support hybrid care in a pandemic and a post-pandemic environment. Our solution and one of our superpowers is a patented process where we simply send a link, collect a date of birth, and then you can connect and engage in any browser and any device. That's it. We can connect telehealth sessions, do forms, and just provide so much value and access and convenience. So really just removing the friction from getting care, I think is really one of our core superpowers here at Mend.
It's a long road to become a surgeon, and there's too much to learn, so you're being spread too thin. It takes about 50 to 100 procedures to achieve basic proficiency. You're relying on random chance to get exposure to those surgeries. With virtual reality, you go from having one tibia to infinite tibias, right? You can get those reps in. You can use it anytime, anywhere. You can train on any procedure. You can train as a team and train remotely. With OSO VR, our mission is to improve patient outcomes and make providers' lives better. It's not replacing real-world experience, but it's enough to get you much further along the learning curve so that when you walk into the operating room, you feel very confident and you know exactly what to do. The Oculus team is so excited and supportive of the work we're trying to do in the world. I can feel it, and it is highly motivating. You can create technology that can impact the lives of billions of patients all around the world. Virtual reality and the Oculus Quest is one of those technologies.
Hear in their own words why they should win.
My name is Justin Broad. I am a former game developer turned orthopedic surgeon and co-founder and CEO of OSO VR. OSO VR is the world's largest VR healthcare company. We have over 209 employees and have raised $109 million in venture capital financing. OSO has been a proud participant in the VR Awards for a number of years and the previous winner of the Best in Healthcare category last year, which we're really excited. But this year, things are getting really crazy here at OSO. I think what I'm most excited about of our newer modules that we're releasing is the clinical validation that we're performing. OSO VR has been proven to be effective in 6 published peer-reviewed clinical studies, the most recent of which was performed at Johns Hopkins, where they compared training in OSO VR with cutaneous haptic feedback and off-the-shelf VR technology with MetaQuest 2 with a fully physical force feedback model. What they found in that study is there was no difference in skill transfer between training with a roughly $30,000 to $40,000 setup with force feedback and training on OSO VR on a $300 headset. So what this means is that a $300 piece of technology is as effective as the most sophisticated force feedback equipment when it comes to skill transfer. This means that we have the opportunity to get high quality, effective surgical training to every single healthcare professional in the world. There are 1.1 million surgeons around the world. 310 million procedures performed annually. And our data shows that OSO-VR can improve performance anywhere from 230 to 300% in published studies, which is insane. We also boast the world's largest surgical training library with over 200 modules in almost every surgical specialty. Thank you so much for your consideration of OSO-VR. I think what we're doing here is very different than other aspects of VR in healthcare or VR training, partially because of the scale, the clinical validation, and the success as a company that we've clearly had.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.